Don't stop.
Hi, everybody. Thanks for joining me on the Everything and Anything in a Bit Day podcast. I'm so happy to be here today and introduce you to my guest, Dr. Williams. But before I get into Dr. Williams, I wanted to tell you about my trip that I just got back from a few weeks ago. I went to New York City. We had my father-in-law's 85th birthday to celebrate. He is 85, but he looks like he's about 65, and he acts like he's 50. And he is just a great father-in-law. And then we also celebrated my sister-in-law's 60th birthday. So we had lots of celebrations. We also got a chance to go and have dinner, just me and my husband with our nieces and nephews. We went to this amazing sushi restaurant called Double Knot. The space was big. We weren't sitting on top of each other. The food was so good. And Double Knot started in Philly, so I'm giving Double Knot a shout out because if you're in New York City, go try it. It was really, really, really good. And I loved my time in New York this time. And it's been a while since I have loved New York like that. I mean, I lived there for 17 years on and off. I was downtown during 9/11 at the World Financial Center. And after that, I just got really turned off of New York. We moved back. But I don't know, just when we moved to Switzerland, we moved back to New York. Like I was so happy to be there again. But then once we moved to Boston, I knew what like space was again, having a house and having not, paying $6,000 a month for a 1,000 square foot 2-bedroom apartment. I don't know. It's just like, it's hard to think about living there again because everything is so expensive. Like I went into CVS to get, I don't know what I went in to get, deodorant or something. And it was like literally like twice the price as if I would have ordered it on Amazon here or went to CVS in the corner of my house. So it's crazy. What is even more crazy is that I used to never really take the subways in New York. I mean, I did when I worked there because I would, that's just what you do. But when I'd go and visit, now you have to take the subways because Ubers are so expensive. We took an Uber so first of all, we normally stay we usually stay downtown in Soho or we stay downtown in Battery Park City. There's two hotels that we love. It's the Conrad in Battery Park City because I've stayed there so many times and I just I love that area because it feels like you're not in the city, but then you can walk over like 3 blocks and then bam, there's the World Trade Center and you're walking into Tribeca and stuff. So it's like, it's a perfect place for me to stay at. And then sometimes there's a Ritz-Carlton in NoHo, which is just, it's so nice and it's so like walkable to everything and it's just a perfect location. But we stayed and we kind of went uptown, stayed in Midtown East this time, and we took we took an Uber from like 53rd Street in the East Side down to brunch with friends at Casa Cipriana, and it was $58 for an Uber. If Ubers were that expensive in Boston, I would buy a car again. Like there's just no way I could afford to do that. So we took the bus several times. We took the subway and we just like everything. And we walked so much. Like one day I walked from 53rd. I walked all the way down to the West Village. I did shopping. I went shopping by myself. It was so nice I had such an amazing time. I got to go to the store down in the West Village. Another shout out I'm giving to a place in New York, a business in New York. It's called the Descendant of Thieves. I bought so many clothes from them online because I always would get their ads on Instagram and I love their clothes. So they make about 150 pieces for each thing they do and they number it. And the clothing is so nice. And once they sell the 150 pieces, like it's gone. There's no more. And so I got to go into the store for the first time because I've never gone there to shop in person. And it was nice, great clothes. I bought a couple of things. I also went up to Columbus Circle to the men's Nordstrom store, and amazing store. All men's, all 3 levels. I believe it's 3 levels. Is it 3 levels? Yeah, 3 levels. I could spend easily $20,000 on shoes that day. Like I walked in there. But I had $800 in gift certificates and I was trying to budget myself. And so I went over a little bit, but I got a couple of cute things from there. And I even bought my husband a shirt. So he's the reason I went over. But I got to have happy hour with friends one night and brunch with friends on Saturday. And we just, I don't know, the whole trip just felt so good. And I also wasn't doing so much of my podcast. I mean, I was doing news every day and doing things like that, but I wasn't like focusing on finding guests or looking through emails and stuff. And it felt like we really got away. But what we did say on the way back is that we want to go away to not like a city. We want to go away to like an all-inclusive like spa resort where you like have your meals are there, you go get massages, you take a hike, you come back, do meditation or yoga, you take a nap, you have dinner. Like there's a place that we go to that's, is it in the Poconos? No, I don't know, somewhere in the mountains in Pennsylvania. And it's amazing. Like, but we went somewhere in Massachusetts and there's a Canyon Ranch and a Miraval or something that's out in the Berkshires, but it's like so much money and it feels like it's not worth it, but maybe it is. Maybe we'll do that in the fall or something. But when we were coming back, I am so used to sleeping in until 10 o'clock because I don't have a corporate job anymore and I do my podcast. So I'm out of bed at 10 o'clock normally in the morning. I come up and I make my coffee and have breakfast after I take a shower or whatever. And then I come up and I start doing podcast work about 11. And then I work until, I don't know, 5:30. Then I usually go back downstairs. Sometimes I'll work again before I go to sleep, a few hours. But I'm like on my own time, which was so nice. And I didn't realize how much, I mean, I knew I was traveling a lot for work, for my corporate job, but I didn't realize how much because it was so much. And I don't miss it because I love being home now. Like it's so nice to be able to plan my life and have a plan. Like I don't have to like look at a work calendar to see if I can go meet friends for dinner one night. Like this week, I'm going to get a massage on Tuesday. Then the following Tuesday, me and my friend Amy are going to this place where they do a microscope in your scalp to show you just how gross it is, even though you wash your hair every day. And then they take 90 minutes and they're playing with your hair and washing it out and putting all this stuff in it. I can't wait. It's like you lay there for 90 minutes with somebody playing with your scalp. It's like going to be the best. I've seen it on social media where people go to this place and I can't wait. But we flew up to New York and we took a train back. My husband loves a fucking early flight or an early train. So I booked us an early 7:41 a.m. train. That means we had to get up about 6:15, get dressed, finish packing, get down to Penn Station. And I can't talk that early in the morning. And he wanted to talk. He wanted to catch up like we haven't seen each other in 10 years talking. Like he just wanted to talk and talk and talk and talk about everything. He wanted to talk about vacations that we could be taking in 5 or 10 years. Let's talk about what house we're going to buy one day. Let's talk about everything. Let's talk about old memories too. Let's just throw it all in there and talk about all of this at 7:30 in the morning. Finally, he went back to sleep. He went to sleep on the train. And I finally, because I had my AirPods on and they're noise canceling. And I'm like, can't hear you. And he didn't care. He was still talking and he would talk louder just so I would hear him. Yeah, that's what he did. And by the time he fell asleep, because I was going into my bag to get my Xanax because I was just, I'm like, I can't do this without taking a pill. But luckily I didn't have to do that. And he fell asleep and we were all good. But I was so over-socialized by the time we got onto that train. We had so many family things to do, which I appreciate and love, but we had so many friend things, which I appreciate and love, and I got to see friends. And we also went to, I forgot to mention, we went to the Brooklyn Bowl. What night do we do that? Saturday night for one of the bands that my husband Andrew wanted to see. And he says, oh yeah, they go on at 7:30. So we got there at 7. And then this Brooklyn Bowl is like, it's small bands. It's got a stage for bands, then it's got a bowling alley, then a restaurant, then a bar. It's like this all in one. It's kind of a cool space, but I asked the guy, there's this gay guy working there. I'm like, well, what time does this band go on? And he goes, oh, 9:30. I'm like, 9:30? We got here at 7. Like, what? What am I going to do? And I don't even like this band. And I had brought my friend Greg with me. Me and Greg are like, these are not our people in this place anyway, because it's a punk band. He loves them. He's loved them for 35 years, but I'm just, it's not for me. And the other thing I'll say is that whenever we travel now, like we have separate beds when we travel because he is a kicker, a snorer. But this time it was a whole different story. I love my husband, so don't get me wrong. I love him very much. I feel very fortunate that we're together. But this is just part of loving and living with somebody and married to somebody for 27 years. This is what it is. Because on night 2 of the hotel, I'm like, what are you saying? Because he's talked in his sleep the entire night. And it's not just like a little bit of like mumble. It's like talking. Then he starts going, help, 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 help. And I wake up and I have earplugs in. I have an eye mask on to have all the light out. Like I shouldn't hear or see anything. He woke me up through that. And I'm like, so who do you need to help? Because I'm helping you. I'm like, you're not helping me because you just woke me up. So you're doing the opposite of helping me. So yeah, this is why we need like a suite moving forward with separate bedrooms, not just separate beds, because the last 2 nights of sleeping in the same room in New York, I don't know if New York was giving him like I felt like I had to get a Ouija board out at some point and like pull the demons out of him because he was like possessed or something. It was way too much for me. Maybe I was like so overtired when that trip is. But anyway, I feel like I have done a long intro and I really want you to listen to Dr. Williams. So Dr. Williams is in the Bay Area. He talked to us about some interesting stories. I love talking to a person, a plastic surgeon, a person that cares about skin, that cares about people, their wellness. So one of the stories that I'll just tell you that really stuck with me that he said, which I'm like, what's the weirdest thing that you've ever been asked to do? What kind of surgery? And he said somebody asked for a tail, to have a tail put on. And, what would you do with a tail? Like, and he's like, it wouldn't move like a cat or dog's tail, so they didn't end up doing it. But this person wanted a tail. I mean, I don't know. I guess, why judge? Like, if you want a tail, then get it. But I don't know. It's a bizarre thing. If it doesn't hurt anybody, like, I feel like do whatever you want. But it feels like a lot to go through surgery to get a tail. Like, what would you do with it? And how would you wear regular clothes? Would you have to get jeans and shorts and stuff, or underwear even, that has a hole for your tail? I don't know. Weird. Enjoy Dr. Williams. I thought he was great. And be sure to subscribe to this podcast if you haven't already. Thanks. Hi, everybody. Thanks for joining me on the Everything and Anything in a Bit Gay podcast. I'm your host, Zach Brandos-Friedman. And today I have an amazing guest. His name is Dr. Stephen Williams. And we are going to talk about a lot of fun things. So welcome to the show.
Well, thank you very much. It's wonderful to be here. And that's a very kind and generous introduction. So I appreciate that.
So kind of talk to me about give my audience a little bit of background about what your job is. Like, what do you do?
Sure. So I am a board certified plastic surgeon. I'm largely in the aesthetic space, although previously I've done a fair amount of reconstructive surgery as well. I am the president emeritus of the American Society of Plastic Surgeons, which means I served as the president of the largest body of organized plastic surgeons, about 7,000 plastic surgeons in the United States and internationally. And so I've had the honor of thinking about patient safety, thinking about patient advocacy, thinking about the advancement of plastic surgery and, what plastic surgery is going to look like for doctors and patients in the future.
And what is your thoughts whenever plastic surgery is obviously, there's a lot of good plastic surgery. There's a lot of bad plastic surgery. What are your thoughts whenever you're seeing these people that are coming online, big names, influencers even,
Sure.
that have completely changed their look? And before I get into that, there's also like this one guy who wanted to look like
There's
Kim
always
Card.
one guy.
Yes. There was a guy, I think he wanted to look like Kim Kardashian and spent hundreds of thousands of dollars to transform his face and body to look like her. What are your thoughts about that? Because to me, there's a mental health issue there in a lot
I
of
think
ways.
I think the person you're referencing, and I don't want to necessarily get into specific patients, but I think the person you're referencing actually has recently died.
Oh,
Yes. And so, you know, plastic surgery, when you're talking about aesthetic plastic surgery, really stems from a place of autonomy. And what I
mhm,
mean by that is it's control over your own body. And in its healthiest place, it's wanting to transform your external self to be more reflective of how you feel on the inside.
yeah,
And autonomy over your own body it's a fundamental part of being human. And again, as an African American person, that resonates with me, as you might
mhm,
imagine, just based on my cultural history. And so when we think about patients having control over their own body, it's incredibly empowering, and it's something that can
yeah,
be wonderful. I think it crosses a line where patients are pursuing some of that for reasons that may not be well thought out or may come from potentially, in some cases, mental health issues. People have to be able to make those decisions in a competent way. They have to understand the risks and benefits to each of these steps. But when it's done right and when it comes from that good place, it's incredibly empowering.
and we'll be right back. Okay, now back to the show. I feel like it's so important for people to feel at home in their body, like how there's so many people that have, I don't know, they have self-esteem issues or they're just, I don't know, they had an injury and they those type of things. So talk to me a little bit about that, how important it is for people to really feel good about themselves, to live their everyday life and just not to feel uncomfortable in their own body.
Yeah, I think you're bringing up two really, really excellent points. The first thing is when people think and talk to people like myself about plastic surgery, they're thinking about the facelifts and the tummies and the breasts, and they're not necessarily thinking about hand reconstructive surgery
Mhm.
or cancer reconstruction,
Yeah.
or I was in a car accident, or my um, you know, functional things that plastic surgeons do every single day for our patients. And
Mhm.
and so that's the first thing. Plastic surgery is more than just someone's facelift. But when we think about people being able to be comfortable in their own skin, people being able to feel empowered, those are, again, really important things that we touched on before. The kind of bad and good part about the last part of it is we do live in a society that values looks. There are some excellent studies that show that people who are more physically attractive, they earn more, they have health, they have better relation, or they have easier access to relationships.
Mhm.
They kind of check that scorecard in multiple ways. Now, is that a good thing? From a societal standpoint, no, it's terrible, because it means that at our core, society still values external appearance instead of what's in someone's
Yeah.
soul or what's someone's heart, or what people can do for the world, the goodness that each human being can bring. But it's still a reality that those physical appearances have societal value. And
Mhm.
without being able to obtain some of that, people unfortunately are, disparaged or discriminated against in society.
I mean, you've had an incredible career kind of in medicine. And whenever people come to you and they are, let's say they've had cancer and they need plastic surgery to help that, or a car
Sure.
accident, the other things. I mean, is that kind of what your main focus is to try to help people have a more um, life that they had before the tragedy that they went through?
I think when we're looking at reconstructive types of surgery, I think there always is that restoration concept. I want, most of the patients that we see say, I want it to be like it was before the car accident. I want it to be like it was before I had breast cancer.
Mhm.
And, the reality is, and what I tell patients that seek those treatments are, you're never going to be exactly the same.
Yeah.
Our goal is to get you as close as possible, as close as we can safely, as close as science will let us. And the nice thing about that is it does offer some hope, and most patients, I think, really resonate with that. And the second thing is science gets better and better all the time. And so the techniques we have are better, the results we have are better, the recoveries are shorter. And so we really do lean into the science of plastic surgery to come up with better and better solutions for our patients over time.
Can I ask you a question just about the LGBTQ plus community?
Sure, please.
And how you know trans people that are coming. Do you have trans patients that are coming to you? I'm assuming.
We do.
Yeah, and how important it is, because I think there's a lot of misunderstanding or misconceptions in the world about trans people and like how they, especially in the United States, and not to get, I don't want to get political, but there's all this, anti-trans legislation and laws and that's happening across the country right now. But when people are coming to you and they're like, this is who I need to be because this is how I was born, but I don't look like this. I mean, how do you kind of approach that with them?
Yeah. And so, again, we're in the Bay Area. And so there are some very active practices involved in transgender surgery. We don't do a ton of it. We do some top surgery, but it's probably not a large part of our practice. As someone who was president of the American Society of Plastic Surgeons, we support people's autonomy to be able to make decisions about their own bodies. One of the hot topics that's been in the media, and again, not to go down the political rabbit hole, is, transgender surgery in minors. And ASPS has come out as saying that they don't believe there's enough scientific evidence to support that as a treatment modality. But I think when you look at adults get to make decisions about their bodies. And it kind of goes back to that initial core. It's like, if you are a competent adult, you get to decide what happens to your body. It's, it's a fundamental part of being a human being.
What are your thoughts on the GLP-1?
Yeah. And so, you're in the media space and you probably have your finger on the pulse of all the hot topics. The two things that have been in the newspaper over the last, year are GLP-1s and AI.
Mm-hmm.
And, they both have impacts on plastic surgery. GLP-1s are a medication that's really transforming health in the United States. It's transforming health globally. It has such a substantial impact that for the first time, we're seeing measurements of obesity go down, which has never happened since the 60s, essentially. We're seeing people being able to, when people come into our practice, we have a GLP-1 program. When people come into our practice and are on our program, they say, this is the first time that I've actually been able to make progress. Because as physicians, we tell people the same thing all the time. It's like, well, diet and exercise, just be calorically negative and you're going to lose weight. And, rightfully so, patients have rolled their eyes at doctors for a decade. They're like, great insight, doc. You don't think I thought about that? You're brilliant. But these medications are really the first time where people have successfully been able to lose weight in a non-surgical pathway. And it's given them some control. But what's even more important is it's made America healthier.
Yeah.
And as a plastic surgeon, we like healthy patients because it means our surgeries go better. We have less complications. As a physician, I want all of the patients out there to need to see the doctor less, to have less chronic illness. And so it's something that's been really, really transformative. And, we're kind of just getting started. The two major drugs that are on the market right now, they're kind of the first generation. We have generation 2, generation 3 medications coming out. Mm-hmm. They're going to be transformative. The access they're going to be less expensive to manufacture. They're going to be more available. The safety profile on these medications, they still have risks. And so it's important to talk to a physician about them. But safety profile is pretty good. And it's much better than some of the downsides to chronic obesity.
Yeah. I mean, I think that I've had friends that have done it it's completely transformed their life. And, there was one friend I had who I'm like, they're not going to have a long life because they're so overweight and unhealthy. And now they're at the gym every day. Yeah. They've got that, they lost enough weight to feel confident to go to the gym and, all that stuff. So
and I think your friend's story is really kind of part of that spark. Once you give people this pathway to success where they have a little bit of self-directed control over their body, where they have a little bit of that thing they've been chasing for so long, all of a sudden those other positive effects kick in. They are being more active. They are being more healthy. They are focusing more on their general state of health. All those things are really, really positive.
And can you talk to me just a little bit about, the I think that people look at plastic surgery and they're like, "Oh, it's the same for everybody." It's not, right? I mean, it's very different. I don't think people talk enough about kind of the diversity of people and that are looking for plastic surgery and being ethical about it and stuff. And I hear you read these stories online about this plastic surgeon that was doing something to supposedly help improve somebody's life, and it was completely, it went the wrong direction. So from an ethical standpoint, can you kind of talk about that? Because I mean, it seems like that's really just the research I did on you. That's one of the things that you really are focused on, is making sure that what you're doing is very ethical.
Yeah, I'm glad you've asked that question. There are really kind of two themes at work here. The first is, it's really important that as plastic surgeons, we don't minimize the potential downsides of surgery. There's risks to everything.
Yeah.
What I tell my patients is, if we're doing surgery, 100% you will have a scar. There's no way to do surgery and not leave a scar.
Yeah.
Now, we want that scar to be small or well hidden or faint, and we expect scars to fade and mature over time. But you will have a scar. Pain, bleeding, infection, these are all potential risks. Not being happy with the aesthetic result, those are risks that I think is really important. And so as plastic surgery is becoming more popular and more talked about, which is great, because I think that it's important that people know that they have these options, not that they need plastic surgery. Nobody needs aesthetic plastic surgery. I tell my patients that all the time.
Yeah.
It's something that you want. This is something that fits well into your life at that point. That's not to say there aren't benefits, there aren't massive benefits for it, but nobody lives or dies based on getting plastic surgery in general.
Yeah.
For aesthetic plastic surgery. And so it's really important to have those conversations. It's really important to take that time and not delegate some of those discussions to your front desk staff or to someone who's not going to be doing the surgery. Patients should feel comfortable having conversations with their surgeon. Their surgeon needs to be board certified. They need to have experience in the procedures that the patient's contemplating. The patient shouldn't feel rushed. They shouldn't feel like the plastic surgeon is discouraging them from talking to other doctors. Those are all, huge warning signs. I think the second theme at work here is also incredibly, incredibly important. We could spend hours talking about it. But as plastic surgery has become democratized, more and more people are seeing this. And when I've been asked to speak about this, I always think about this nurse that I worked with for a really long time. And she was African American, and she's such a wonderful person. And she would always call me. It's like, "Oh, we have a dog bite. His 5-year-old got bitten by their dog. Can you come in and take care of them?" And I would come in the middle of the night. And as a team, we would take care of those patients. And it was like that for a decade and a half. And she finally came to me and said, "I think I want some aesthetic surgery for myself." And I'm like, "Oh, well, yeah, of course. Come on in. I'm happy to take care of you." And after it was done, she did great. And she said, "I never felt like I deserved this. I felt like that these types of things weren't for me, and the way I looked was my fault, and I didn't deserve to have things that would make them better." And again, as someone who thinks about these things all the time and considers myself relatively progressive, I was like taken aback. I was like, "Oh gosh, there are people who are walking around who don't think that they deserve these types of treatments." And again, I'm not saying that everybody should get plastic surgery. I'm not saying that at all.
Yeah.
That people are like, "I'm just going to age gracefully, and if they sag, they sag." Great. That's absolutely fine. People deserve to be able to make that choice. But I do think when we have populations of people who think that they don't deserve this, or this isn't something that would ever be offered for them, and that's somehow culturally baked into kind of their perspective, I think that means we have some more work to do, in terms of just talking about things. And I think podcasts like this, I think some of the exposure and topics you're exploring, I think that's really helpful.
And we'll be right back. Okay, and now back to the show. Do you have a patient that you can think of that you really changed their life, and you're just like, wow, if they didn't do this, they would not have been living their full authentic life? Like, do you have somebody like that you can kind of think? I'm sure there's lots of them.
We do. And I think as plastic surgeons, that's part of the reason, we go into this. Plastic surgery is highly competitive. Most plastic surgeons could have been any type of physician they wanted to be. But we like making these kind of deep impacts. And the wonderful thing about plastic surgery is we treat all ages and kind of all parts of the body for all reasons. And so sometimes it's that, 3-month-old that if you don't do particular surgeries, they'll never be able to eat properly and they'll be malnourished. Sometimes it's someone who has breast cancer who just wants to feel normal again.
Yeah.
Sometimes it is this, the 60-year-old who's like, I'm at the point in my life where I want to focus on me and I want a facelift. It's really that complete spectrum. But what I tell my colleagues and kind of how we try to position our practice is we're not the heroes. I think in these social media eras and this kind of this everybody's a brand and everybody has an image.
Yeah.
I think it's easy to, as a physician, fall into the I'm the hero, I'm the superstar. But what I tell my team and what I tell other colleagues is we are just the enablers of the heroes. It's their story. We're just the ones that help them follow that hero arc in the story.
Yeah.
And I think that's a really powerful perspective. And I think as physicians, when we look at it as it's their journey, it's their priorities, it's their role to judge whether it changed their life or not, I think that's the best place for a plastic surgeon to really live. I think it's too easy to be like, oh my gosh, I'm so great. I've changed so many lives. And in the back of our mind, of course, we think that because we're human and we get satisfaction and happiness from making people happy and from doing successful surgeries. But I think it's always important to say we are the tool for the hero to complete their journey.
What would you say to somebody that's kind of come to you and said, I'm not happy with myself, I want to change?
Yeah. And so we have those conversations on a daily basis with our patients. And, the first thing I say is, well, what parts aren't you happy with?
Yeah.
And if someone says, well, I just wish I had a little bit of a better shape here, I'm like, oh, we can definitely do that. Sometimes we have patients come to us and say, well, my spouse just doesn't find me attractive anymore. And there's problems in our marriage. And I just feel like if I looked different or better, that would make things better. Those situations you have to be very, very careful about.
Yeah.
And the reason why is not to say that we are going to take a patriarchal role and say, well, I know what's best for you. This surgery isn't for you because clearly you need to focus on your relationship or you need to lead him or her. Not our role. But it is important to say, look, if a flatter tummy is going to make you happier or make things better, then I think I can do that. But you have to assess how that physical change is going to impact your expectations and your goals in your relationship or in your workplace or in how you look at yourself. And those elements, they require a conversation. You can't just be like, yep, here's the menu, choose, okay, ready to go.
I mean, we live in a world where it's fillers and Botox and, you can go on, you can use AI to say like, this is what my perfect face would look like if I did this. I mean, you must get some insane requests of people that come in and like,
I'm going to tell you the craziest request I ever got. And I said no. Just to kind of ruin the story before I tell it, I said no. But I had a patient come in and say, I want you to make me a tail.
A tail?
Yes. And I said, well, it's physically possible. It won't wag, but, I can create this thing that hangs off, the lower part of your back. But like, why do you want to do that? And this is just curious. For me, that was just curiosity, but I already decided I wasn't going to do it. But they said, well, I just think it would be kind of cool to have a tail. I'm like, okay. That person is probably pursuing surgery they're probably minimizing the seriousness of surgery. They're minimizing the potential risks and they're minimizing what that's going to look like in 10 years, 20 years in terms of the impact of that surgery on them. And so we get crazy requests all the time, but you have to kind of balance that patient autonomy with are you doing it for the right reason? And should we discuss, your motivations and kind of explore that a little bit better to hopefully you'll have better insight, or maybe you'll convince me that your insight is actually perfect and we should make you a tail.
Yeah.
Hasn't happened yet.
Yeah.
The tail part, at least.
I mean, are there trends like that? I mean, hopefully
Oh,
getting
yeah.
it. that-
Oh, my gosh. And
I mean,
social media, yeah. And
yeah.
Zach, I think you've really hit on it. Social media has become this fuel, this gasoline that's poured on the fire, because it does, social media is not great, is the bottom line.
Mhm.
It's incredibly corrosive to teenage girls. It does really kind of elevate this concept that we all have to be perfect, that we all have to have perfect lives. Social media's currency is envy and greed and unobtainability and hatred. That's what drives the algorithms. That's what makes social media companies money. We're on social media because that's where patients look for answers.
Yeah.
I think that you have to have, I think there's some positivity to having a balanced voice to talking about the realities of plastic surgery. So we occupy that space almost as a buffer and a guardrail. But it has a lot of negative things. Now, the good things are it's easy to find communities. It's easy to find support. There is tons of information and personal stories about personal journeys in every aspect of life, essentially, including
Yeah.
plastic surgery. But overall, this concept of I have to be young forever and the physicality is my primary value, those are overall negative things for society. And that's coming from a plastic surgeon.
Yeah. I love it that you said that. I didn't think I'd ever hear that from a plastic surgeon, but that's kind of amazing that you have that way of thinking, because social media is, I think, dangerous in a lot of ways, where it makes everybody wants to be beautiful and everybody wants to have this amazing life. And if you look at their life behind the scenes, it's really probably not
Right.
who they really are.
Right. And I think it's hard for people to appreciate that a lot of this is manufactured and not real, and this veneer that's been placed over reality. And I think there's a lot of normalcy for this chasing the unobtainable, and this real feeling of loneliness and failure when you're not able to say, oh, I wasn't in Ibiza like twice this year on a private jet. It's like, yeah, nobody was, but social media really normalizes some of these kind of once in a lifetime, once in a billion person type of experiences that we're all supposed to kind of do that. And that's where we're supposed to find our happiness. And that's really the corrosivity of social media.
Do you think that we'll get to a place as a society where people will think, who I am is enough? And maybe, like,
It would be great.
I mean, like, I see fillers and Botox as like, okay, like if you don't overdo the fillers and stuff, like, I actually think that's okay. I don't do fillers. I'll do Botox, but I don't do fillers or anything like that. But I understand the plastic surgery piece for, like you were talking about, if somebody has to have reconstructive surgery because they had breast cancer or they had a car accident, like that, I think all makes sense. I think also if a woman wants to get breast implants because she would feel more confident about herself, I kind of see that. Okay. I just think that some people just take it, they see somebody that they have found on social media, not that they want to look like that person, but they see this amazing lifestyle that they have. They're like, if I can just have a little bit of what they have done, then I could have that same life. And I feel like that people are disappointed because they could do the work, but they don't actually have that same lifestyle.
I think your insights are really spot on here. I think, unfortunately, there is truth that the more attractive you are, the younger you look, it does open doors. Unfortunately, the science shows that that's 100% true. And it's not great. It's not a great comment about our society. But I think social media really does elevate that to an unobtainable level for people. It really kind of puts it in this situation where you have to be young forever. We look at, people who have literally their careers are about looking good, and the lengths that they have to go to, and then they still fall short when, like, there's a little bit of makeup off.
Yeah.
The Kardashians are kind of a classic example of that.
Yeah.
You get a facelift. Kris Jenner had a great, she had a great facelift. They've had great plastic surgery. And then the minute there's a little bit of, one new wrinkle came back. They're like, oh my gosh,
Yeah.
they're out of the spotlight. Like, that's crazy, right? And so we have to find that balance. We have to find the balance between, yes, you have the right to do the things that you want to your body because it's your body. And I'm chasing something that is unobtainable. I'm chasing something that's unrealistic. I'm chasing something that is manufactured and fake and really is just making the social media companies money and eroding society. It's a strange space right now because social media really has poured substantial fuel on this concept that you have to be beautiful forever.
Yeah.
And nobody is.
Yeah.
At least externally.
Yeah. What are your thoughts about people that are going to other countries to do plastic surgery cheaper? So,
Yeah.
Turkey has the hair transplant that men are going to. You go to Mexico, you can kind of get everything done for, a fraction of the cost. I mean, if I was going to do any of that stuff, it would scare me because I feel like, are they following the same, standards that you as a plastic surgeon, that was how you were trained in the United States? I feel like you could get over there and you don't really know who you're seeing, and I to me, it's a scary situation. I have a friend that wants to go to Turkey to do a hair transplant and I'm trying to talk him out of it actually, because I'm like, what do you know about this doctor that you're going over there? What's the care like afterwards? What if you get an infection while you're over there? Like all these things, and I think I've talked him out of it, and he's going to do it in the United States instead. It's going to be a lot more money. But I'm like, is your life or getting an infection and being more sick or whatever worth going to Turkey to get a cheaper hair transplant? So what are your thoughts kind of about all these people going to other countries to get cheaper surgeries done?
Yeah, medical tourism is exploding. And part of it is, again, social media. People are able to find communities, find doctors, find solutions more broadly now. Part of it is definitely 100% access and resource driven, meaning that sometimes it's easier to find a plastic surgeon who could do your surgery right now. Like, get on a plane, I can do it tomorrow. And it's almost universally cheaper to go outside of the US. Now, again, as the benefit of being past president of ASPS is I have worked with some amazing international plastic surgeons, and there are good plastic surgeons in every single country. There are people who do amazing work. And so it's not to say that the United States has a chokehold on plastic surgery, that there's no good surgeons anywhere else. I think what is true, there's two things that complicate the picture. Number one, it's hard to know in some countries who's good and who's not.
Mm-hmm.
And the United States struggles with that, right? We have people who are like, I'm a cosmetic surgeon. And it's like, well, wait a minute. Are you a board certified plastic surgeon? Well, I'm a cosmetic surgeon. I'm board certified internal medicine doctor, but I've got a room in the back that we just do it, And so it's not a problem that's just international surgeons. It also happens in the United States. But I do think that sometimes in other countries, there is a little bit less transparency. There's definitely a lower medical legal barrier in other countries. And what that means is here in the United States, if a plastic surgeon commits malpractice or any physician commits malpractice, there's a medical legal pathway that patients can pursue to become more whole. And, we can debate whether that's good for patients, whether that's good for medicine, whether that's good for physicians. But the point is, it means that we all generally try to adhere to the standard of care. In a lot of other countries, those rules don't exist. And that has pluses and minuses. When you look at some of the best body contouring that's happening around the globe, it's South America. And when I talk to these surgeons, they're great surgeons. They're amazing surgeons. But when they're talking about, we're doing rib remodeling, we do some rib fracturing, it's just now coming to the United States where we're like, okay, you guys are doing it in South America. We know what you're doing. Let's try it here. Mm-hmm. But because there's a lower medical legal barrier, they're able to do it down there. And it's like, they get a couple of pneumothoraces. Yeah, a couple of people died, but they sign the consents and those things happen. In the United States, that can't happen. No. So it's kind of this weird duality where people say, well, look at these results in South America. And I'm like, well, yeah, but like 2% of the people die when they're undergoing this. And that's not an acceptable level here in the US. And so part of it is being able to find those physicians that are good, and there are definitely good plastic surgeons in every single country out there. Part of it is, are you okay with the difference in the medical legal standard maybe being less of an incentive for physicians to make sure you're getting the top care, especially if you're flying in, and especially if they know they're never going to see you again
Yeah.
because, hey, I did it, and they're back home, and it's not going to be they're going to be knocking on my door, bugging me every month. Like,
Yeah.
maybe we'll just use the cheaper suture because it's an American and we won't see that. The last thing is the thing that I think that you emphasize that is an immutable factor, whether patients travel from other countries to see me, and we have international, because I'm an unknown name, I have international patients all the time. But one of the most important things is coordinating that aftercare. What happens if there is a problem? What happens when I'm looking through my webcam trying to say, is that incision healing the way I want it to? It's always better to be able to see your patient in person. It's always better to be able to assess them. And so if you're traveling for surgery, you have to find resources locally that are going to support you. And that can be very, very difficult. We see patients all the time that's like, I had my surgery somewhere else. I need you to come take my drain out or figure out when the stitch. I'm like, I don't know, because I don't even know what you had done necessarily. I don't know their techniques. I haven't seen the operative report. And so that post-operative care and managing complications gets very, very complicated, and it can be a real safety thing for patients.
We'll be right back after a word from our sponsors. Okay, and now back to the show. All these years that you've been doing your job, and has it made you change the way that you see beauty?
Wow, what a great question. So I speak all the time, and I don't get asked those types of questions very often. And so
is that a good or bad?
That's a great. No, it's great. I love when people ask me things I haven't thought about. I do think what my career pathway has allowed, and when I say career pathway, I mean the fact that I did tons and tons of reconstructive surgery early in my career. I do less of it now. The fact that I have a very busy aesthetic practice now. The fact that I was the leader of essentially all the plastic surgeons, in the United States, and the majority, a large portion of the plastic surgeons globally for a while. I think it really has expanded my scope in terms of supporting patient autonomy, and in terms of reinforcing the fact that there are multiple standards of beauty, and this kind of one size fits all is not great. And I think plastic surgery's come a long way. I do think that there's been a lot of progress in listening to patients and saying, what are your goals? And here are different ways we can achieve those. And I think it's also wonderful that patients have become much more vocal in their self-advocacy in saying, I don't want you to give me the rhinoplasty that everybody got in the 80s. Here are the things that really bother me. I want you to talk about techniques that specifically address the things I care about. Maybe I don't want to erase all the ethnic qualities of a particular body part. And so those, I think, things are really, really great. And so the evolution, I think, has been one of almost full circle. It all comes back to the patient. It all comes back to listening to the patient, understanding the goals, and creating a plan that works for their specific needs.
Whenever you end your career one day and you retire, what would you love your legacy to be?
Yeah, a great question. I think that, I love technology. I love aesthetic plastic surgery, but I think the main thing is advocating for autonomy, and advocating for patients having a voice in their care, and having access to care. I think those are critical parts. And I think any society that measures its own success has those as core principles. And so the small things that I can do to move those things forward, those are incredibly important for me. And if I was remembered as making a small difference in those elements, then that's a successful career.
Just a few more questions. What do you think about the whole NAD thing? Because that's all over TikTok. And I have to say, I've ordered them. I started taking them, and collagen vitamins every day. So what are your thoughts? Am I just taking nothing?
There's a whole supplement and peptide, and there's all exosomes. There's all this economy and this commerce based on patients wanting to do things that help themselves. Patients wanting, doing their own research. And I read this thing, and I'm gonna spend this money. the truth of it is most of it doesn't make a gigantic difference. Even vitamins, in some sense, if you don't have a specific vitamin deficiency, these vitamins that we kind of walk down the supermarket and put in our basket, or have Amazon deliver. I guess I'm dating myself how old I am, but they generally aren't helpful to our overall health. They're certainly not as helpful as having a reasonable diet, getting exercise, being around people you love, and spending quality time with them. Those things are much, much, much more important to your health than NAD or vitamins or in particular peptides. And so a lot of what happens is there can be some truth in early science, and the exosome market's the classic thing. Exosomes definitely involve cell signaling. They definitely can improve healing or affect how things heal. They can definitely affect how collagen is expressed in the skin and elasticity, but in very specific, very narrow ways. And the fact that to think that you can just go to the shelf and pick up a bottle of, exosomes that are going to make your skin better, that's fiction. That doesn't exist, because that's not how exosomes work. And, the cost for something, it'd have to be specially tailored to you, and it has to be stored, in a medical freezer, and it has a certain shelf life, and you have to make sure that the cell line you got it from isn't contaminated with something else. Like, it would be literally hundreds of thousands of dollars, not $30, on your dermatologist shelf. And so I would just advocate for patients to, when they say to do the research, and that's great. I think people should self-actualize, but the research is usually really, really hard. It's really, really painful. And, don't discount peer-reviewed journals. Don't discount, thinking after you've read a bunch of these papers, wow, I have a headache and this is a lot more complicated than I thought. That's probably a sign that you're actually really doing the research. Because as physicians, when we look at it, they're like, wow, these pathways are complicated. Who it works in is complicated. And one kind of easy litmus test for patients to take is you should think about, if you're able to buy it, you should think about what the warning labels are. And so the classic example I always kind of give patients are, when they ask me these questions, when someone says, well, this says it improves my skin elasticity. I'm like, oh, okay, well, is there a big warning on it for people who have collagen disorders that they can't take it, that it could kill them? And they say, well, no. And I say, well, that probably means it doesn't work, because if something truly has a physiologic effect, it's almost never for everybody. There's a certain population that cannot take it, that it would be incredibly detrimental, maybe even fatal for. And so if you don't see those warnings on it, it probably doesn't have a real effect.
Oh, good advice. I think everybody wants that pill that you can take one day, and it's the Fountain of Youth pill.
I want it too. Look at me.
Me too. You look great, so I don't say look at me. So I just want to kind of end with just saying that I think that the work that you do and the way that you kind of come across is so amazing. And I hope that you do sometimes take a moment. I would ask you to do this, is if you don't do it, is to take a moment and just kind of reflect back on how you have helped improve and make people feel so much better, whether it's reconstruction or it's just making them feel better about themselves. I mean, you've helped so many people in your career, and you should really be proud of that, to make people feel like they have a better life,
You sound like my mom.
I mean, it's really like amazing. And I just respect just how you just value the ethics of your job and stuff, and how you really want to make people feel better about themselves and live a full life and stuff. So I think it's awesome.
It's a very kind thing to say, and I really do appreciate it. There's just so much to do, and so it's hard to kind of sit and maybe I should be kinder to myself. I don't know, but there's really a lot to do, and life is short, and so I just want to do better. I want to do more for patients. I want to do more to move things forward in a patient-centric fashion, and so I'm just grateful that I have the opportunity to do my little part.
It's awesome. Well, you're a great person, so we need more people like you in the world.
Thank you so much. Thank you. That's so kind of you. Thank you very much. Very kind.
If you want to learn more about Dr. Williams, you can go to TriValleyPlasticSurgery.com. I will put that link in the description of this video or podcast, however you're getting this, and check him out. He is in the Bay Area in San Francisco, and he seems like a great person to go see if you have questions. So thank you so much for being on, Dr. Williams. You were an amazing guest.
Zach, thanks so much for the time. It was a really amazing time, and I'm always available. I'd love to be back on sometime. Thank you.
Thank you so much.